I always say that acupuncture works on a physical level, emotional and psychological level. It's also good for children, especially certain children who have certain kinds of behavioral issues can be really helpful sometimes in helping them calm down.
It's a big question. How can a needle in the foot affect other things?
It can even work on a spiritual level.
Ooh, should we talk more about that?
Generally, it's painless.
Don't try this at home, people. Welcome back to Street Smarts MBA, the podcast where we teach you how to be an adult. And today, how to be a healthy adult. We're talking about acupuncture, what it actually is, what it isn't, and why so many people only look into it once they're already exhausted, burnt out, or dealing with pain they've been ignoring for far too long. My guest today is Zack Gutman, a licensed, nationally board-certified acupuncturist and Chinese medicine practitioner based in Denver, Colorado. Zack has been practicing for over a decade. He trained at the Colorado Chinese Medicine University, and in addition to his private practice, he's also on the faculty there, meaning he doesn't just treat patients, he helps train future practitioners as well. Zack is the first person I run to when I'm in Denver. And what I appreciate about Zack's approach is how grounded he is. He works with real life issues that people are actually dealing with: stress, sleep problems, digestion, hormones, pain, burnout, you name it. So today we're going to break acupuncture down in practical terms, how it works, who it's helpful for, and what people tend to misunderstand. So Zack, thanks so much for being here. Finally, after all this time, we have you here on our show.
Thank you, Alpha. Great to be with you today.
So why did you pick acupuncture for the life mission here?
It's a great question, and it's one I think that every acupuncturist has sort of a unique path to. But in my case, I loved acupuncture. I had it done back in the early 90s for the first time. And I think I had had a acute sort of back sprain where I was lifting something and hurt myself. And a friend of mine had mentioned she was going to an acupuncturist, and I thought it sounded really interesting. So I tried it out and it immediately had a great effect, and thought it was so interesting and felt all kinds of new sensations in my body that I didn't know existed before that. And then I continually went back here and there for different things over the years. And then at a certain point, I think this happens to a lot of acupuncturists, either they have a health crisis of their own or someone close to them has a health crisis. And they come to the medicine in that way where they want to do something more to help other people with their suffering. So in my case, I had someone close to me who I wanted to help more. And I felt like, what I'm doing right now in my life, I need to do something more profound in the sense of being able to help that person directly. And that's how I got into acupuncture.
That's incredible. So let's start off with, what is acupuncture? For someone who's never done it before, how would you explain it?
Sure. Well, let's start a couple thousand years ago, mostly in Asia, probably China, Korea. Acupuncture came to Japan a little bit later. But there were a group of people who began to develop this medicine. And the medicine was developed around observations in nature. And acupuncture became one part of that. We know this because they found tombs and they have written transcripts in these tombs in China that talk about actually puncturing specific anatomical locations in the body for an effect. So we know this several thousand years old. The herbal component of Chinese medicine goes back even much further. So in a more modern context, if we jump to present day, we have individually wrapped stainless steel sterile needles that we puncture the skin in those specific anatomical locations to cause effect. And you might think of it as using a few needles to write a sentence. So today I'm going to write a sentence with these needles, and the needles say, I want to help Joe with his sleep this evening. And he also has a little knee pain. So we might use the needles to sort of write that sentence and have the energy, the human energy in the person rebalance itself. It's quite amazing, actually.
So what's physically happening in the body during a session when you're making that puncture?
Well, there's different ways to perceive that. The first way is to perceive that is what's happening in the body if you're the person on the table, the patient. So the patient may experience certain sensations of relaxation. They may experience things like little twitches. They may feel like water running through their body. They may feel heat sensations or cold sensations. And that would be the body trying to achieve homeostasis. the other sensation, or different things that I should say happen from a more scientific standpoint, Western science would say the hormones may be rebalancing. There may be a clearing of inflammation. There may be a quickening of blood circulation, these types of things. Also, I must say, almost every acupuncture treatment, it feels like to me, and I can't say this for every single person, but I'd say most people, they experience a reset from sympathetic nervous, sort of our daily grind nervous system, into what we'd call rest and digest, parasympathetic nervous system.
I could really use that right now. So for people who, when they hear acupuncture, they think needles.
Yes.
And I know from my own experience that there are different types of needles that acupuncturists use, and some of them really scare me. Would you tell more about that?
Well, it's like the right tool for the right job, right?
Uh,
So kind of not unlike a carpenter.
mhm,
You don't want to use a hammer for every single activity you do when you're building a house, right?
mhm,
Or a
mhm.
screwdriver. So you need to have different assortment of tools. So mostly with the needles are different lengths and different gauges or thicknesses. Acupuncture needles are solid. They're not hollow, like as if you go to the doctor to have blood drawn, it would be a different kind of needle. So almost always less painful. Now and then we get one that may be more painful or a little spicy on a needle insertion, but generally it's painless.
Mhm. So, what are the most common reasons people come to see you for the first time?
Oh, wow. Well, I think there's a lot of pain. A lot of people want relief from pain. And I would say aches and pains in general. So that could be a couple of weeks ago, someone who was visiting in town, they lift their suitcase, threw out their back. That would be like one example. Let's take a different person, maybe someone in their late 70s. There's some neuropathy. They've had some back surgeries. The nerves are impinged somewhere coming out of the sacrum. And so in this case, we would try to do acupuncture to help with the circulation and relieve some of that numbness and get more sensation back in their toes. So the thing being here in this case, maybe if the toes are numb, it's harder to stand in balance if you're older. So acupuncture can help with all these types of things and then some.
When patients come in, what surprises them after they come in for a treatment?
So one thing we try to do with acupuncture and Chinese medicine is to look at each case individually. It's really different case by case, depending on the person. But I'll say this, one thing that does come up a lot is that how can you treat a headache by putting needles in the foot? So in other words, there are certain parts of the medicine that are very dynamic and don't make sense from our usual American perspective that go back. And if you remember what yin and yang is, which is sort of that, you remember the symbol. And so that's a really profound image that goes back a long time. And it explains sort of our universe, but also our bodies as well. And so there's yin and yang and continual perpetual motion and change within us, which we know blood cells being made, blood cells dying off. Each breath could be seen as this change as well, right? Oxygen coming in, binding with iron in our blood, right? Carbon dioxide being exhaled. So these are the kinds of things that people experience, and they're somewhat surprised. Is like yin yang, how could it be that we treat the foot with some needles, helps my headache, which is not near the location site whatsoever? I'd say that's the main one.
Yeah, I remember a time when I injured my back and I tried stretches, I've tried different exercises, I've tried hot cold compresses, baths, nothing helped. So I finally go in to see you. And I remember the exact point on my leg, on my shin, that you put in a needle and I could feel the pain leaving my body from that spot. I could just feel it go away, real time. It has not been back since.
That's
Uh,
wonderful.
yeah. So when people ask, they ask the same thing. It's a big question. How can a needle in the foot affect other things? So that's the example I give because after all the years I've been going to you, I was still surprised at the effects of it.
Acupuncture can be like almost miraculous in that way sometimes.
Mhm.
Not in every instance, but
Mhm.
sometimes it really is just one needle in the right place and really change the whole game board, if you will.
So what do needles feel like?
Generally, they're really they don't feel like much. I actually took one out. I'm going to open one. This is like an individually wrapped needle. It's sterile. And this is a very thin one. It's a 40 gauge needle. And I don't know if you'll be able to see that at all. So it's very thin.
Hmm.
And I can
Hmm.
almost like paint with it, like brush my skin, if you can see it.
Mm-hmm.
It's used one time only. And then that going into the skin, if I'm doing my job correctly, you barely feel it. So
Yes, that's
everyone's a
true.
little different. Some people are very sensitive. And so for those people, they're going to feel a little more. Some people don't feel anything at all, and anywhere in between.
But you decide what needles to use, right?
If they've had a lot of acupuncture and they request something, I will definitely keep that in mind because they've had a lot of acupuncture. They know what they like. That's fine. So ultimately, the patient's in control. If there's a spot they don't want to be needled on the body or, a needle they don't like, I'm totally fine to follow that. But
Mm-hmm.
generally, as the rule goes, I'll usually choose.
Mm-hmm.
So, and usually most people don't have a problem with that.
So how do people feel right after a session? I know that I have a successful session if I pass out, if I'm able to fall asleep. And it's usually very, very deep sleep. And I come out feeling really relaxed and the world looks very different. Okay. The sky is bluer and everything looks more peaceful. So is that a usual reaction?
I think so. I think some people will feel more energetic actually sometimes.
Oh,
Depending on what you're working on, if like,
uh-huh.
there's just like a release of tension where everything is bound up and all of a sudden it's freed and you can flow more. So people sometimes feel more energetic, but
Hmm.
oftentimes people do feel like really super relaxed. And
Hmm.
yeah, I always consider that a good sign. Some people do fall asleep. Some people just kind of float there, almost meditative. I would say it's like lazy person's meditation in a sense because you can feel really meditative and relaxed without doing as much work as like traditional meditation, which I always find is like, you have to put a lot of effort into it really to get it going. So yeah, that would be generally the rule as well. Some people occasionally not, acupuncture is not for everybody, honestly. There are certain people who it just doesn't really do much for them. There are certain people who don't really feel much. There are other people who maybe it's not a good idea if they're afraid of needles, for example. Certain people who are going to pass out when they see a needle enter their body, that sort of thing. Sometimes people have certain kinds of prone to certain kinds of skin infections you want to be careful with. There are different protocols for pregnant women as well.
Hmm.
And then very, very weak people can sometimes not be the right person for acupuncture. It does take a little energy to kind of rebalance the energy. So if they're super weak, acupuncture might not be the best thing.
People go in for acupuncture when they feel something's off. When would you recommend acupuncture? Who would you recommend it to?
Well, certainly if you feel something's off, let's just say something simple like shoulder pain.
Hmm.
I hurt my shoulder playing tennis a few years ago, and it's just always achy. It's improved somewhat, but I want to get rid of it completely. Or maybe I did it 2 days ago and it's not gone away, and now I want to get it treated. Just about anything like that. We treat a lot of autoimmune, chronic as well, chronic diseases, oftentimes so it's like possibly neuropathy associated with diabetes, something like that. Could be other autoimmune disease. We treat a lot of women's health, irregular periods, pain associated with the period, no menstruation.
Hmm.
There's a lot of acupuncturists now who specialize in fertility treatments for both men and women, honestly.
Hmm.
That would
Oh.
be a huge one.
Hmm.
I myself am on the board of directors of a nonprofit here in the Denver area that focuses on pediatric acupuncture. So it's also good for children, especially certain children who have certain kinds of like behavioral issues can be really helpful sometimes in helping them calm down. So most to everybody. Then there's also the other kind of acupuncture. It's more preventative.
Hmm.
That tends to be like there is a longevity strain or strain in the thinking about acupuncture that it was sometimes said that maybe the best acupuncturists are the ones who help their clients from ever getting sick. So people would sometimes do herbs, Chinese medicine, acupuncture to help themselves stay healthy so they never even get to the point where they're feeling ill. I'd also just like to say that I recommend acupuncture for anyone probably over 40. If you're over 40, maybe once every couple months. If you're over 50 and definitely over 60, at least once a month. I just think it's really great to help balance people's energies and it'll help with everything else they're doing in their health journey.
What role does a placebo play in all of this?
No role, in my opinion, but
Hmm.
I'm an acupuncturist and I'm biased, so keep that in mind. There are a lot of skeptics around Chinese medicine and acupuncture. So let me address some of the skeptics. I would just say that, let's say that acupuncture has been around for, we'll just be conservative, very conservative estimates, like 2,500 years. How does something exist for so long if it has absolutely no value and no empirical sort of value to a population to help them maintain health. Now,
Hmm.
does it fix everything all the time? Of course not, but I don't think any health modality does. It's just one more tool to have in your toolkit, right? I would never tell someone, for example, to stop getting a yearly doctor's visit just because, you're getting acupuncture now. I mean, that makes no sense. I think people should do blood tests and see where the different markers are doing. So, like, what's my cholesterol? How's my iron? All these different things are important. Acupuncture is just one more medicine that you'd want to have in your toolkit. Going back to the toolkit again, should you just have only your doctor, or do you want to have other things too, like an acupuncturist, maybe a massage therapist, maybe an athletic trainer, or a dietitian or a coach of some sort? You can go down the list, and all these people can really help you in maintain the best health and your best sense of yourself and optimum vitality so that you can live your best life, I suppose. There are nerve endings and fascia reactions all throughout the body, everywhere on the skin, right? It's there for a reason. You're puncturing the skin with something and it will have a reaction, and it may be considered like a placebo reaction. But I would just say that it's hard to sell people for 2,000 years, 2,500 years on something that completely is fake and doesn't work. I just don't think over time people would just be hoodwinked by that. And we have lots of empirical evidence, and I've seen it myself and I've experienced it myself. So for me, I know oftentimes the people who tell me those things have never had acupuncture.
And I know a lot of doctors have started utilizing acupuncture in combination with their practice. So, like urologists, for example,
Yeah,
or
absolutely. So, urology is the one thing we do treat. Urinary frequency would be something we treat a lot. More and more urologists are sending people to acupuncturists to help with that. Or they've even taken some of the sort of things that acupuncture are doing and then integrated that into their own practice.
so a lot of adults are living in chronic stress without realizing how much it's affecting their bodies. Can you talk about how stress actually shows up physically, not just emotionally, physically, what's actually happening in the body?
Well, when we have a stress reaction, there's a lot of oxidative stress. So your body begins to create toxins from that stress. And over long term, it just builds up in the body in different places. Now, the body also stores these toxins in different places. And this is a very general sort of thing without breaking down all the chemistry of it for some parts of this. But it's just as simple as like, why are my shoulders always so high for some people? And I have shoulder pain and neck pain. It could be as simple as that. So that's a pretty simple one. We see that a lot. I think a lot of people are aware of that they do that with stress. But
Hmm.
different people store that stress in different places. And so we might see it in the shoulders, neck. We might see it right abdomen. Some people, any kind of stress, stomach upset, different kinds of stomach issues, possibly alternating diarrhea and constipation. And so the body has a way of compartmentalizing some of these reactions, these nervous system reactions. Acupuncture can help with that, help reset that nervous system and move what we say, move the stress. It's worth mentioning too, something called what we call chi, which is your vital life energy. And so it's what animates us, the chi, and gives us our life and our life force. So one of the things we're doing is trying to move and balance that energy continually and build it also, tonify it and make it stronger. And that gives us better health.
Sometimes people go to see a doctor because they're exhausted and they don't know what's wrong with them. And they've tried everything. Physically, they're fine, but they're just tired and have this feeling of burnout. How easy is it to restore the chi?
It depends. Once again, it's all case by case. There's never one size fits all. Doesn't really work in acupuncture too well. So
Hmm.
it's more case by case, but what are the levels of toxicity in the body from chemicals, bad food, drug and alcohol abuse? Sometimes I've seen this happen where someone has a living situation where they have like mold in their apartment. They don't know it. It's completely affecting their immune system and their health. So it just depends
Hmm.
in that
Hmm.
regard. But it definitely can help with that. And it just depends on the person. How committed is the person? Like if you walk into your acupuncturist, you're going to see this person. Let's say if you see them a lot, you're probably seeing them once a week for most people. That would be a lot. Most people see me once every couple weeks or once every month, once every so often, depending on what they're coming for. But how committed are you to the process and then making changes in your life that are going to help you? Obviously, diet's going to be a huge thing. Probably the most important thing you can do for yourself. That's for most people 3 meals a day. And you only see your acupuncturist once, every couple weeks probably. And so all that time you spend eating healthy foods or non-healthy foods, that's going to make a difference. I
Mhm.
do think this though too. I have met some people who err a little bit too much sometimes on the extreme where they'll never allow themselves any kind of joy with their food. And I feel like long term, that's not a healthy concept either. Every
Mm.
now and then you might need to cheat for a day or something like that, or a meal, let's say not even a day, but just a meal. Like, for example, maybe you haven't had a slice of pizza in 3 years and you're feeling no joy in your life right now around your food. Maybe you need to go have a piece of pizza.
You know that after a session, you would not recommend, aside from alcohol or physical, probably physical exercise, you wouldn't recommend some sugary things?
Oh, absolutely not. Yeah, I mean, maybe a tiny bit of juice or something like that. If you're just
Mhm.
right afterwards, just to affect your blood sugar a little bit and have it come up if you're feeling
Mhm.
really drowsy. Something
Mhm.
like that might be okay. But I would say in general, no, you want to eat something healthy. Soups. Well, healthy depends on the person too,
Mhm.
what they're going through, how much work they've done with diet before, do they
Mhm.
have food sensitivities, what's their gut health, all
Mhm.
those things are going to be important. So, I can't think of anything probably more individual than how someone eats. People have to find that out for themselves. And there are like functional medical practitioners out there who do work regarding, gut health. And that's very important as well. We do that with Chinese medicine and herbal medicine as well.
Do you have a lot of people coming into you for weight loss?
I personally do not see a lot of people for weight loss, but it can help with that. But
Hmm.
once again, what's the most important thing with weight loss is going to be diet. Acupuncture can help with maybe some of the stress responses and cravings, and so can some herbal teas. But ultimately, it's what you eat at that point, I believe. Are you ready to make that leap? Are you ready to exercise more? Are you ready to drink more water? Just like, there's a few things that come to mind. So we can help rebalance the energy, set the table for you to help you make the right decisions, I feel like. And I always say that acupuncture works on a physical level, emotional and psychological level. And then for people who want to go there, it can even work on a spiritual level.
Oh, should we talk more about that?
Spiritual level. Well, first of all, people who want that, some people are looking to evolve themselves in certain ways in the world. All I'm trying to do is listen to what they say and read their energy and help them reset their energy so in focus to what they want. What's their direction? So I'm just sort of carrying the message.
Along those same lines, I've had some amazing experiences while I was under the needles. I felt like my mind was going someplace where I saw the light. Those were very healing sensations, I would say. So it wasn't just what was happening in my body. I felt something happening on a different plane. So when they first come in to see you, they first book their first acupuncture appointment. What should they expect when they come in?
Well, I really want them to eat something. Like, don't come on an empty stomach. Don't have like, quadruple venti espresso before you come. Don't smoke marijuana before you come or drink alcohol. Like, none of that, right? So you really want to come in hydrated. You want to wear loose fitting clothing. You want to be ready to be open and listen to what I have to say as well as what your expectations. I want to hear what you have to say. So anything you can do as far as like what medications you're on is important to bring. Also, what's ailing you and have you thought about it at all? So sometimes people it's very simple, but sometimes it's more complex. There's a lot more there. And over several sessions, people will continually inform me of something else new that they forgot to tell me, which is always really interesting.
Why can't they come in after smoking, say, marijuana? What does it do?
Well, marijuana, for example, is a good one because and I used to have people who'd come in and it would just I just felt like it was a waste of time for them and for me.
Really?
Yeah. So, I live in Colorado. It was one of the
Right.
first states to legalize marijuana. And I used to have some clients that would come in who were actually worked like clipping marijuana. They were big into smoking all day long, basically at their
Hmm.
work. It was part of the culture. And I don't judge the culture, but I will say this is that it's kind of like I'm just setting you back to zero. If you're really drunk or really stoned and I put needles in, we're not making progress in any direction. I'm just making you back to zero, kind of ground zero, if that makes sense, where you're just back to more normal. You're not stoned anymore, but you haven't really made any progress on your issues that you want to work on either. It does treat certain disorders in the human body. For some people, it really works for them. But you could say some people say, well, I feel better with a drink too, or other drugs for that matter.
Yeah.
So it's
Yeah.
a little subjective. As a general rule, I would say it's not a good idea. You really
Hmm.
want to come in as together and clear as possible. I'd also say it's not great to go home after an acupuncture treatment right after. I used to have a guy who'd come in and he had back pain. He felt great when he left, and he'd go to the bar right afterwards, have like 4 beers, and then tell me the next week that it felt good until he had 4 beers and then came back the next day. And I'm like, well, of course, you want to give your body some time to reset and rebalance. And so I usually say for people after an acupuncture treatment, it's best not to drink, smoke marijuana, other recreational drugs. You really don't want to go home and watch the scariest movie you've ever seen afterwards, or put on the world news. And, if you're affected a lot by that, some people are really affected. It's not a good idea either. Or even like, sexual behaviors, you probably want to abstain for one night from that just to let everything reset. So things that are really like more jarring to your nervous system, you
Mm-hmm.
moderate. And the best thing is just like, go walk your dog if you have a dog, take a light stretching, one
And you also
mile,
said
even
drink a lot of
seconds.
water.
Drink a lot of water, absolutely.
Mm-hmm. Mm-hmm.
It'll help cleanse the body of any toxins that are released, reduce inflammation.
So clearly, you have to find a good acupuncturist. You can't
Yes.
just go to whomever and then expect miracles to happen. You have to find someone who actually knows what they're doing. How do we know? How do we pick a practitioner that we could trust?
Yeah. I mean, the first thing is, right, they have to go to acupuncture school. It's not
Mm.
something you're self-taught. Not a good idea. I mean, I used to paint and I never went to art school, and I'm sort of a self-taught painter, not a great painter by any means, but it's super fun to do. You can't do that with acupuncture.
Mm.
So you really need to go to school, and then through that process, you end up being licensed in the state, whatever state you live in. So you need
Mm-hmm.
to have someone who's licensed in your state. And those are the two main things right there.
Mm-hmm.
Then there's like sort of the more intangible aspects of it. So you may try an acupuncture or two and not have a great experience. And you really want to find someone that you resonate with and you feel like they get it, they get you, and you get them somewhat too. So I would say that's also super important.
What does the initial consultation look like with you? What should it look like? Because I've been to some acupuncturists and it was just a few minutes. Well, what do you need help with? They don't ask deep questions like you, for example, do. Is that normal?
Well, I think everyone's a little different in their style. So
Right.
acupunctures, there are many different styles, and obviously different practitioners are different people. They have their own way of going about things. I personally want someone who's going to spend a little more time with me, who's going to ask
Hmm.
more questions. Not everyone's like that. Some people really want to go, if you're the person who it's all business, I have so much to do, I want a quicker treatment, less questions, just do your thing, get on with it. Some of those people might respond or resonate better with someone who's more like going to ask just a few questions, get the needles in and go. It just depends on the person. For some people, it's a profound experience. For me, it was. My first acupuncture treatment was profound. I remember when he came and he kind of twisted the needles a little bit, and I felt like someone was turning up the volume on my energy, like as though it were like a radio, and you could just turn the volume louder. And I thought that was just the most amazing thing. That's another thing about acupuncture. It's going to open up the dimensions of your thinking around your body and your health, what you know it to be. You'll feel energy in a different way in your body, I think, than if you've never had acupuncture. That's why it's sometimes so hard to describe to people some of the sensations, and until you've actually tried it.
Any red flags that we should watch out for when we do find a practitioner, aside from certification?
Absolutely. First of all, you want someone who's going to obviously respect you. So that means a lot of things. One of the things that means is like if they're working on sensitive parts of the body, they're draping you correctly,
Oh.
if that makes sense.
Yes, yes, okay.
So
Draping,
in
you
other words,
mean you're
yeah,
not just laying there exposed.
you're not laying there exposed for the whole time, and
Hmm.
they're communicating with you. People who don't communicate with you, I've always had a red flag with. I think with any healthcare, anywhere, just about anything, anywhere, actually, but especially this, right? It's going to be a more personal experience, and someone you're entrusting somebody with your health and your body. And so it's really important that they're going to communicate to you. If you feel like they're just blowing you off, that's not good. If you feel like they're not respecting your body, not draping you properly, that is also not good. Each needle should not hurt, like one or two can, but generally it shouldn't be a horribly painful experience the whole time. And if it is, and you give them that feedback, are they reacting appropriately to that? Like they should be able to back off. Occasionally, there's some like a procedure where, it's going to be a little painful for somebody sometimes, but the acupuncturist should explain that to you ahead of time. It shouldn't be a surprise to you.
I'll tell you, there's one experience where Well, I haven't gotten to an acupuncturist since I've seen you last, but a while ago, there was an experience where I woke out with my ear full of blood. I thought, oh, something's wet. So I touch it and there's blood on my hand, like a lot of blood. And I said, is it normal? She says, yes. Is that normal?
Well, I don't know if it's normal, but I will say this, the ears and the head tend to bleed more easily.
Mm-hmm.
So I'm not completely surprised to hear that, so
Mm-hmm.
the ears will bleed some. Acupuncturists are definitely not infallible, myself included.
Mm-hmm.
I will put a spicy needle in some from time to time, or there may be like you can needle someone, it breaks a blood vessel, it could leave like a tiny bruise there. These are
Mm-hmm.
things that should be explained before you've ever had acupuncture. Maybe the first treatment, that would be something else that you'd want to look for. Are they explaining to me basically what adverse events could happen? What could go wrong, in other words, as opposed to also what could go right? There should be a little bit of a mention about that too. It's not without its risks. But at the same time, it's considered very, very safe. If you feel, considering how many events that happen that are damaging to someone's health that are recorded, how many needles are actually inserted in someone, I mean, it's very, very, very low.
What would you say to people who they have a bunch of needles at home and they say, I'm going to do this on my own. I have a few pressure points here or the tension points that I'm trying to relieve. And so I'm going to try this at home. Buy some needles off of Amazon. Can you do that off of Amazon?
I don't think so, but
Oh,
maybe they could get them somewhere, maybe if they try hard.
right, from China. And they try to want to do it themselves. What would you say to people who are, because it's all a do-it-yourself culture too. We do everything ourselves now.
Yeah, this is definitely not like a YouTube video. If I want to fix my washing machine, I may go to YouTube and watch like a couple videos and see if I could actually fix it, right? Something like that. But you
Hmm.
don't want to experiment on your body like that without any training and supervision. It's a really bad idea, in my opinion. I think that what you'd want to do is either go to school, number one, if you really do have that kind of interest. That would be my first suggestion. But if you're going to do it otherwise, you can do a lot of damage to yourself. But probably you could do more damage than you could do good oftentimes. There are a lot of areas, like say the chest, for example, where you could collapse a lung. You could hit an artery or a vein that you don't know about, or deaden a nerve, or other things, just depending on where you would be working on yourself. So I don't recommend it. If someone was, say, a physical therapist, or they had some training in anatomy, it might be a little bit more feasible, but most of those people who do that even go to courses where they get trained somewhat.
Hmm.
Not as much as an acupuncturist, but they'll go through some training. So,
Hmm.
really bad idea. Just like you wouldn't give yourself an IV at home. And I know nowadays with peptides, a lot of people do give themselves certain kinds of injections, but this is a little different. I just don't recommend it.
Because I know in some cultures, for example, where I'm from, I grew up with my mother cupping my back.
Yes.
So would you say cupping is a little safer than needling? Oh,
Absolutely. I think
okay.
there are certain contraindications for cupping as well. People maybe who are on blood thinners, you have to be really careful of, or have bleeding disorders, clotting disorders, things like that. Maybe they're really weak. For every modality, there's like things you have to be very aware of. But needles, sticking needles in your body is not for the meek. There's just a lot to
Okay.
do. But some of this is very old, based off of folk medicine. And it's been researched now and has come into a more contemporary context. But above all else is safety. You really want to be safe, because if you're trying to do something and you're trying to cure something or get a more favorable result with pain or maybe the nervous system, you may end up having the opposite effect if you're not trained properly and you make a mistake.
All it takes is just to hit in a nerve somewhere, right?
Absolutely.
Yeah.
Or worse yet is to go through the chest somewhere and then go into the lung, and then you pull that out and you're punctured the lung, which is a really bad idea. So it's kind of hard. You have to try a little bit to do that, but you can do
Hmm.
that. And someone who's untrained is more likely probably to do that than someone who's trained, I would think.
Wow. Well, thanks a lot. Don't try this at home, people. There have been a couple of times when I would come in and you would recommend certain herbs. What are some of those herbs that you have used and recommend to people?
Chinese herbal medicine is like a vast ocean to find incredible solutions to health problems. And what we call formulas are mixtures of herbs. Some of these go back to sort of the godfather of Chinese herbal medicine, and I'll probably butcher the pronunciation. So, someone out there, please forgive me, Zhang Zhongjing. And he's sort of the well known godfather of Chinese herbal medicine. And many of his formulas, if you look on some of the Chinese medical literature that they teach in schools, will say 220 AD after that. So it may say a formula, and then it'll have formula X, let's call it, and it'll say the author of the formula, which was this person, and then it's 220 AD. So it's that old. It's over 1,000 years old and close to 2,000. Amazing.
Mhm.
So this medicine's been around so long. There are a lot of different substances involved in Chinese herbal medicine that can help you. Now, there's also a lot of newer sort of supplements that can also help in Western culture that are good to know about as well. And you really want to talk to some different practitioners, either an acupuncturist who's been trained with herbs or functional medicine people, even your doctor, of course, primary care physician. Get input from all these people and find out what's best for you. Then you have to try those. Some herbs work better for some people, some not so good. So it just depends. Like, for example, ginseng is a pretty popular one that some people use. Some
Mhm.
people don't do very well with ginseng. It really upsets their stomach or they get really jittery. So that's just like one example. But there are other people who have incredible, feel so much more energy, have incredible success with that herb. Turmeric's another one, anti-inflammatory herb. It's used a lot in Chinese medicine, but oftentimes just taken by itself. Nowadays, you'll see a lot of people recommend that. So that would be another one you want to watch out for. With any of these modalities or herbs, you really, if you're pregnant, it's a whole different ball of wax for you. You really want to go out and get the information because a lot of things will be off limits to you. You have to be very
Mhm.
careful.
Mhm.
And that includes the acupuncture. And then also, so we do acupuncture for a lot of women who are pregnant. It does help them, but the points that we do might be very different than if you weren't pregnant. Same thing with any kind of herbal medicine.
Do they need to get an okay from their doctor, medical doctor, to come see an acupuncturist?
I don't know that they need
Uh-huh.
an okay from them. I don't know
Hmm.
that it's required so much, but it's never a bad idea to inform all the different health practitioners that you have of what's going on. It's good
Okay.
to have that open line of communication. Someone may think of something that maybe I wasn't thinking about that informs me in a really great way to help you, and
Hmm.
vice versa. That
Yep.
way, you the patient too gets all of the information as well, and you're accumulating that knowledge for yourself.
Does insurance cover acupuncture?
It does in a lot of states and certain healthcare plans that people have.
Hmm.
I think certain things may be covered under Medicaid nowadays. Certain things are covered under the Veterans Administration as well. They have their own acupuncturists on staff at many of the locations. That's very particular, though. Some acupuncturists will bill for insurance and others will not. So it just
Hmm.
depends on the acupuncturist. Most
Okay,
acupuncturists, however, will give you a receipt that you can take to your insurance company, if nothing else.
that's great. Thank you so much for breaking this down in such a clear way. I hope that people who are hearing this are it dispels some of the myths and fears for them. How can people find you?
Feel free to send me an email at greatriveracupuncture@gmail.com. That's one word, Great River Acupuncture. I'm involved with a non-for-profit here in the Denver metro area, and it's called Jade Kids. It's really a great organization, helps a lot of people. And we're just trying to continually keep this process going for children in the area. There is a donate button, and this will help kids, regardless of the family's ability to pay for pediatric Chinese medicine services.
What age are these children, and what are some of the things that they're struggling with?
They range in age,
Hmm.
honestly, and they could be 3 or 4 years old up
No
to
kidding.
16
Wow.
years old. Yeah, 17, really anyone who's a minor.
Wow.
And so some things could be behavioral issues where they
Hmm.
just cannot focus. It could be something where we had one child who was, if I recall correctly, she had so much fear she couldn't go outside, couldn't go to class, and would just be in the house forever. She finally got over it enough to go see one of the practitioners who began helping her, where within a year or two, she was back at school. So it was really profound. And there's all kinds of other stories as well. And if you think about it too, like, I mean, for me at least, and I can't say for everyone else out there, but for me, I wonder if I'd had access to these kinds of medicines and modalities as a young person, how that would have benefited me and how that would have changed the course of my life. If I didn't have as much, let's say, stress or anxiety as a younger person, would I have made maybe slightly better decisions at certain times? Would I have been a little bit more clear about myself and certain things. So I think it can really help people.
I'm booking a flight and flying over.
I'll be here.
Thank you so much. So, for listeners, if this episode sparked curiosity, maybe to pay attention to your body before it forces you to do that, preventative care is there, and acupuncture is a great, great way to go. So, thank you so much, Zack, for being here and for sharing all this with us. I hope you come again because I'm sure listeners will have questions, more questions about this. This is Street Smarts MBA, and we'll see you next time.
Thank you.
Thank you.